Hello, welcome po to our Friday Dialysis Warrior live streaming. Ayan, welcome po sa lahat ng nandito and kumusta po kayo? Ayan, hindi ko nakikita ang ating comment. Ayan, kumusta po ang lahat? Ayan, nandyan na po si Only Nedge. Ayan, si Sister Bernadette Blog. Sir Mike Cubs blog from Ireland, Jillian Sheen, and Rodeline Amistoso channel. Yan, hello daw po. Ayan, and welcome po to everyone who is tuned in at the moment. And we're doing this every Friday to reach out to millions of viewers all over the world, especially po dyan sa ating mga dialysis warriors. Yan po. Just to introduce po, my name is Haji. I'm a nurse here in UK. I've been doing renal nurse in UK for 20 years. And I'm also a transplant and dialysis support group UK mentor. And I'm also part of the dialysis support group in Philippines. Yan. So marami po tayong nare-receive ng mga common questions, from our patients from dialysis, transplant, UK, and same with the dialysis support group in Philippines. Yan. And we're happy to help, where we can. Doon po sa mga simple questions na gusto nilang malaman, especially doon po sa mga bago sa dialysis or new to dialysis. Yan. Oh, hello, Sister Only Nedge. Yan, salamat po sa inyong pagpasyal. In a minute po, you will try to play the video about a very important topic, which is the acute kidney injury. Yan, very important po. But before that, I want to do some shout-outs. Shout-out po kay Arlene Rovira. Ito po ang aking si Mary Abad. Yan po ay matagal na po natin friend in YouTube since I started. Jean's Blog, Gays TV, Annalyn Adnan, she's a new friend from Kuwait. Hello po, Sister Annalyn. And just a few days ago, I've met another blogger from UK. And his channel name is Kusinerong Pinoy Vlogs. And he lives in north part of UK in Northumberland. Yan po. Yan, shout out din po kay Ever the Great UK. I just realized Ever the Great UK is just a neighbor here in UK, which is only like 15 minutes drive. So he's not far from where I live. So it's good to know that, get another, YouTuber around. And also shout out to our renal team, especially my family on G9. So, shout out po. Mega love shout to everyone. Okay. Ayan po. Hello, Sister Lynn Sorson. Ayan, harang daw po. Ayan, salamat po sa inyong paharang. Okay. Kumusta po kayo lahat? Tayo po magkape-kape muna kung nasan kayo. Just have a kappa, as they say in England. Let's have a kappa. Yan. Okay, so in a minute, we'll play our video regarding acute kidney injury. So keep tuning in. Okay, I think most of you guys are still on the advertisement part of it. Yan. And according to Lynn Sorson, she's still on the advertisement part of the broadcast. Ayan, ayan. Welcome to our 10 million viewers, 11 million viewers. Ayan, that's it. Just keep it coming. And we will start the topic about acute kidney injury. So I want to thank everyone, the 13 million in the house, okay, for tuning in. Okay, so we're going to start our video. Haji here from Adobong Briton. Welcome to our Friday live streaming. And before we start, I would like to welcome two of our new channel members. First is Lalin Sarlatan. She blogs about travel, cooking, and poetry or hugot lines. This is her channel. And also I wanted to welcome Team Doremi. Team Doremi is a Filipino family, lives in Ireland. And Team Doremi is also a dialysis specialist nurse in Ireland. So welcome to our two new channel members. In today's topic, we're going to discuss about acute kidney injury or AKI. Acute kidney injury or AKI is where your kidneys suddenly stop working properly. It can range from a minor loss of kidney function to complete kidney failure. AKI is not the result of a physical blow to the kidneys, as the name might suggest, but happens as a result of another illness. This type of kidney damage is usually seen in older people who are unwell with other conditions, and the kidneys are also affected. It's essential that AKI is detected early and treated promptly. Without quick treatment, abnormal levels of toxins can build up in the body, which affects the ability of other organs to work properly. If the kidneys completely shuts down, then a person may require temporary support from a dialysis machine. Depending on the cause, and may include too little urine leaving the body, swelling in legs, ankles, and around the eyes, fatigue or tiredness, shortness of breath, confusion, nausea, seizures, or coma in severe cases, chest pain or pressure. In some cases, AKI causes no symptoms and is only found through other tests done by your healthcare provider, such as blood tests. AKI needs to be taken seriously. If left untreated, this can lead to kidney failure or even death. AKI is different from chronic kidney disease, where the kidneys gradually lose function over a long period of time. What causes acute kidney injury? Acute kidney injury can have many different causes. AKI can be caused by the following: decreased blood flow. Some diseases and conditions can slow blood flow to your kidneys and cause AKI. These diseases and conditions include low blood pressure, called hypotension or shock, blood or fluid loss such as bleeding, severe diarrhea, heart attack, heart failure, and other conditions leading to decreased heart function. Organ failure, overuse of pain medicines called NSAIDs, which are used to reduce swelling, relieve pain from headaches, colds, flu, and other ailments. Examples include ibuprofen, ketoprofen, and naproxen. Severe allergic reactions, burns, injury, major surgery, and direct damage to the kidneys. Some diseases and conditions can damage your kidneys and lead to AKI. Some examples include a type of severe life-threatening infection called sepsis, a type of cancer called multiple myeloma, a rare condition that causes inflammation and is scarring to your blood vessels, making them stiff, weak, and narrow, called vasculitis. An allergic reaction to certain types of drugs called interstitial nephritis, a group of diseases called scleroderma that affects the connective tissue that supports your internal organs. Conditions that cause inflammation or damage to the kidney tubules, to the small blood vessels in the kidneys, or to the filtering units in the kidneys, such as tubular necrosis, glomerulonephritis, vasculitis, and thrombotic microangiopathy, blockage of the urinary tract. In some people, conditions or diseases can block the passage of urine out of the body and can lead to AKI. Blockage can be caused by bladder, prostate, or cervical cancer, enlarged prostate, problems with the nervous system that affects the bladder and urination, kidney stones, blood clots in the urinary tract. You're more likely to get AKI if you're age 65 or over. You already have a kidney problem, such as chronic kidney disease. You have a long-term disease, such as heart failure, liver disease, or diabetes. You're dehydrated or unable to maintain your fluid intake independently. You have a blockage in your urinary tract, or are at risk of this. You have a severe infection or sepsis. You're taking certain medicines, including non-steroidal anti-inflammatory drugs or NSAIDs such as ibuprofen, or blood pressure drugs such as ACE inhibitors or diuretics. Diuretics are usually beneficial to the kidneys, but may become less helpful when a person is dehydrated or suffering from a severe illness. You're given aminoglycosides, a type of antibiotic again. This is only an issue if the person is dehydrated or ill, and these are usually only given in a hospital setting. What tests are done to find out if I have acute kidney injury? Depending on the cause of your acute kidney injury, your doctor will run different tests if he or she suspects that you may have AKI. It is important that AKI is found as soon as possible because it can lead to chronic kidney disease or even kidney failure. It may also lead to heart disease or even death. The following tests may be done. Measuring urine output. Your healthcare provider will track how much urine you pass each day to help find the cause of your AKI. Urine tests. Your healthcare provider will look at your urine or urinalysis to find signs of kidney failure. Blood tests. Blood tests will help find levels of creatinine, urea nitrogen, phosphorus, and potassium, in addition to blood tests for protein in order to look at kidney function. GFR. Your blood test will also find your GFR or your glomerular filtration rate to estimate the decrease in kidney function. Imaging tests. Imaging tests such as ultrasound may help your doctor see your kidneys and look for anything abnormal. Kidney biopsy. In some situations, your healthcare provider will do a procedure where a tiny piece of your kidney is removed with a special needle and look at under a microscope. Those at risk of AKI should be monitored with regular blood tests if they become unwell or start new medication. It is also useful to check how much urine you're passing. Any warning signs of AKI, such as vomiting or producing little urine, require immediate investigations for AKI and treatment. People who are dehydrated or at risk of dehydration may need to be given fluids through a drip. Any medications that seems to be making the problem worse or directly damaging the kidneys needs to be stopped, at least temporarily. The most serious complications of acute kidney injury are high levels of potassium in the blood. In severe cases, this can lead to muscle weakness, paralysis, and heart rhythm problems. Fluid in the lungs, we call it as pulmonary edema, acidic blood, metabolic acidosis, which can cause nausea, vomiting, drowsiness, and breathlessness. Treatment of AKI depends on what's causing your illness and how severe it is. You may need to increase your intake of water and other fluids if you're dehydrated. You may need antibiotics if you have an infection, to stop taking certain medicines, at least until the problem is sorted. A urinary catheter used to drain the bladder if there's a blockage. You may need to go to hospital for some treatments. Most people with AKI make a full recovery, but some people go on to develop chronic kidney disease or long-term kidney failure as a result. In severe cases, dialysis may be needed, where a machine filters the blood to rid the body of harmful waste, excess salt, and water. So there you have it, guys. Hopefully you like our topic today about acute kidney injury, and hopefully you've learned something from it. Once again, thank you very much for tuning in our Dialysis Warriors Friday live streaming. Again, this is Nurse Haji. If you're new to my channel, don't forget to like, share the content, and put your comment down below if there's anything else you want me to feature on my next video. Don't forget to hit the subscribe button as well. And while you're on it, don't forget to hit the notification bell so you're always notified on my next video upload. Lastly, I want to give a shout out to all my teams, Team Pito, Team Just Us, Team Bato, Team One Goal, One Dream, and Team Explorer. Thank you for all your support, guys. And also a shout out to Axel Gonzalez, shout out to RR Ramilo TV, shout out to Jinvi Velasco on channel Miss Halakhak. So I hope everyone have a good day, and I'll see you on the next. Ayan. Thank you po for tuning in. Ayan. So, thank you, sir. Lynn from, wala, tayo makasunod. So, si Sister Lynn Sorson. Sir, tanong ko lang, lifetime ba ang catheter? Hindi po lifetime ang catheter. Teka, nawala na ako sa ano. Yan. I'm back in the picture. Ayan, Lynn is asking kung if the catheter is lifetime. Now, catheter is, if you're talking about, are you talking about urinary catheter, Sister Lynn? Sabi niya dito, halimbawa kung nagsimula ng i-catheter ang taong may kidney failure. Depende po kung anong catheter ang sinasabi niyo, Sister Lynn. If you're talking about urinary catheter, that is temporary po. So, ginagamit lang po natin yung catheter to measure the urine output. But that is temporary. We don't normally keep the catheter in place. If you're talking about catheter where, we use for dialysis, yung pong ginagamit sa dialysis, then that could be, say, semi-permanent catheter. Ayan, sabi ni Kuan. Ayan, sabi ni Sister Lynn. Yes, urinary. Yan. Opo, pagka po urinary catheter, that is only temporary. So, that is to measure ang in and out of ng fluid. Intake ng fluid mas match dun sa urine output. So, yung urinary catheter po is a way to measure the function of the kidney. Yun lang po, just to measure the intake and output. Yan. Ayan, sabi ni Sister Lynn, okay. Thank you so much, sir, sa info. You're welcome po. Ayan, thank you po sa lahat ng nandito ngayon at nanood ng ating very important video about acute kidney injury. And yan, hopefully po may na-pick up kayo. Ayan, Sister The Explorer's Vlog. Ayan, salamat po sa pagtambay nyo dito. And thank you to, yan, 13 million na po. Got 13 million in the house. Yan, thank you to all of you. Yan, I've got few messages from our dialysis group. Yan, meron po dito. There's a question here. Yan, meron pong question dito. Bago lang po. Ayan, good morning po. Bago lang po ako dito. Actually, ang mama daw niya ang patient. Kakatapos lang ng opera niya sa tiyan kahapon ng 5:30 p.m. At ngayon po ay nasa hospital pa rin kami. So, first time nito first time nung mama niya na magkaroon ng ganitong situation. At ganun din po ako kanya. First time lang din po ako makakita ng dinadialysis. So, meron po dito tanong siya kung paano maaalagaan ang patient na nasa peritoneal dialysis. Yan po. Ayan, shout out daw po. Sabi ni Neneng Sintonado TV, shout out to Team Explorer. Ayan, ito pong si sister natin dito sa dialysis group dito sa Philippines, was asking about how to look after a patient on peritoneal dialysis because her mom and herself is new to dialysis. So yan ang mga tinutulungan po natin. So ito po, meron po akong 9 things to mention about this dialysis, peritoneal dialysis. Ayan, mega love shout from Jesse Boy Vlogs. Ayan, mega love shout po. Kaway. Ayan, kaway. Mag-ready ka na at mamaya meron tayong concert. Baka mamaya rayumahin ka na naman. Ayan. Yes, Sister Neneng Sintonado TV. Yes po, LS po ito. Yan, Sister Neneng, mag-ready ka na rin at mamaya meron tayong concert na naman. Ayan, salamat po Kaway Kuy sa iyong patamsak. Ayan, hello Island Kitchen, Camiguin Island Kitchen, hello po. Ayan, salamat po sa inyong pagpasyal sa ating live streaming. Okay, anyway, going back to that question, on the PD, ang suggestion ko sa kanya is make sure na bago buksan ang mga bag ay maghugas ng kamay. Yan, linisin ang mga surfaces na paglalagyan ng malinis na bag. Ito po yung dialysis bag na ginagamit niya. Kung Baxter po ang line niya, make sure na hindi masalat or mahawakan ng dark blue tip nito dahil yan po ang pwedeng pagmulan ng infection. So sa catheter po, meron po tayong ganyan. Yung pinakadulo po, yan po ang iniiwasan nating hawakan. Yan po ang very, very prone to infection. Yan. Sabi ni Kaway Kuys at Neneng Sintonado TV, kala ko premier ito. Ha. Nagmadali ako. Kaway Kuys. LS po. Oh. Live streaming po tayo. Yan. Sabi ni Sister Neneng Sintonado, kasali din ako ulit. Naku, wala ako rayuma. Oo po, siyempre. Of course, Sister Neneng, kasama ka palagi. Ayan. Yan, other suggestion is check nyo din po yung exit site ng catheter. Yun pong pinagpasukan ng catheter dito sa may tiyan. Make sure na walang signs of infection, may mga redness o nag-develop ng crust. So, check lang din po natin regular yon. Make sure na regular po ang pagdumi ng pasyente. Dyan, common po ito sa may peritoneal dialysis dahil yun pong bowels nila dapat po laging clear. Kasi mahirapan pong mag-drain yung fluid pagka po merong dumi kasi po yung catheter ay napupush up. So, hindi niya po nare-reach yung bottom ng peritoneum. So, hindi po niya na-drain ng mabuti. Ayan. Ayan, sige lang po. Hello host, mega love shout. Thank you Essing and Jessie Channel. Mega love shout po sa inyo. Ayan, si Sir Orlando Oliver. Ayan na si Idol. Tapos, ayan, si Kawai Kuis. Tawagan ko muna Sir Angelito Jr. Gamit. Okay, wait host. Okay, no problem po. No problem. Laxatives, yan po ang very important for peritoneal dialysis. Laxatives and high fiber diet, that can help as well dun sa bowel movement po. Kaya importante po sa peritoneal dialysis patient yung naka-regular laxatives. Okay. Check nyo din po ang dialysis output ng inyong mom kasi dapat po ang output niya is clear. So pagka galing po sa peritoneum, pag nag-drain po ng fluid, dapat po nakikita nyo see-through siya. Hindi siya, pagka nagkaroon na po ng cloudiness dun sa bag, this is an early sign of infection dun sa peritoneum. Pero yan po, yan ang mga chine-check po natin. Dapat wala siyang cloudiness. Chine-check din po natin kung mayroong mga fibrins. Yung fibrins po parang mga jelly dun sa loob ng dialysis output. Normally po pag may ganyan na pwede pong ma-block yung catheter at binibigyan po namin sila ng heparin dun sa bag para maalis yung blockage niya. Ayan, according to, ayan, si Camigin Island Kitchen, hello daw po sa lahat. O yan, may question po dito si Sir Orlando Oliver. Ano daw po ang maganda? Peritoneal o hemodialysis? I think we covered this last week or 2 weeks ago. It's a personal choice po yung peritoneal o hemodialysis. Just to differentiate lang po, yung peritoneal dialysis, ito po yung dialysis na ginagawa po natin sa bahay. So 4 times a day, tapos daily po yun, yung dialysis na yun. Hindi po kayo alis sa bahay lang po kayo magda-dialysis. So dalawang klase po yung peritoneal dialysis, Sir Oliver. Meron po yung kinatawag nating CAPD o yung continuous ambulatory peritoneal dialysis. Ito po yung dialysis na naghahang tayo ng bag, dinidrain sa peritoneum, tapos i-drain out po natin. Yan po yung continuous ambulatory peritoneal dialysis or called CAPD. Meron din po tayo yung APD, yung automated peritoneal dialysis. Yung automated peritoneal dialysis naman po, yan po yung we connect ourselves on the machine at night time. Then we do our treatment overnight. And when you wake up in the morning, you just disconnect and you're free to have the whole day for yourself. So dalawang klase po yan. Isang CAPD, isang APD. Okay. Ang pinagkaiba naman po nung hemodialysis, yung hemodialysis po, yan po yung pupunta kayo sa hospital o sa dialysis center. Okay. Yan po yung mag-a-attend kayo ng 3 times a week. Tapos every session po mag-dialysis kayo ng 4 hours. With regards po sa difference niya, ang hemodialysis is ano ba 'yan, mas, mas maano siya sa katawan dahil 3 times a week lang siyang ginagawa. Pupunta ka sa center, hihilaan ka ng ilang litro na fluid para tanggal yung excess fluid sa katawan. Tapos ang changes po ng toxin dahil madalang mag-dialysis mataas, tapos bigla kang hahatakan. So, kung meron po tayong mga cardiac patient na naghi-hemodialysis, medyo strenuous po sa kanila yung hemodialysis. Mas gentle ang peritoneal dialysis po kasi daily po tayong naglilinis ng dugo. So, yun po ang mga difference. Ano pa? Pag peritoneal dialysis po dahil araw-araw tayo nagda-dialysis, konti lang ang tinatanggal ng fluid every day. Mas matagal pong na-preserve yung urine output ng patient compared to hemodialysis. Because on hemodialysis, every time you dialyze, they dry you out. So, ang nangyayari, yung body po natin is laging tuyo. So, eventually, dahil po laging tuyo yung katawan natin, susunod, hindi nawawala na po yung pag-ihi. Mas mabilis pong mawala yung tinatawag naming residual urine. Yan po ang pinagkaiba niyan. Yan, ano pa? Mas gentle, yes, mas gentle ang peritoneal dialysis compared to hemodialysis. But I'm not saying it's whichever is the best. It's a personal choice po yun. Depende po yan. Ang main reason po ng ang mas best is it depends sa how it will give you a better quality of life. Kasi po kung nagpipili ka, tingin mo mas gentle, pero feeling mo nasa bahay ka lang, na tied up ka na, hindi ka makaalis, then that's no quality of life. So kung mas prefer mo yung dialysis, then do the hemodialysis. So yan po is a personal preference. Okay. Na tayo. Yan. Sabi ni Sister Nedge, akala ko host yung ano yan? Nakakahimatay na topic. Low volume lang ako. Sister Nedge, don't worry, there's no blood involved in here. Okay. At Kawai Kuis, sir, mga senyales na may sakit ka sa kidney? Ayan, siguro na-late itong si Kawai Kuis do sa ating video. Ayan. Kinover po natin yan kanina. Kawai Kuis. Yan. Yun pong unang mga signs na meron kang sakit sa kidney. Yan po yung pagbaba. Number 1, yung pagbaba ng inyong pag-ihi o pagkonti. Kasi mapapansin yan, parang kumunti yata yung pag-ihi ko. So yan ang mga unang senyales. Tapos pwede po kayong katagalan dahil nasira ang inyong kidney. Yun yan, yung kino-cover natin yun is can be temporary kasi acute kidney injury lang siya. So pwedeng temporary, reversible, wag lang mapapabayaan. Kasi pag napabayaan, pwede siya maging chronic kidney disease or pwede siyang mauwi na end stage. Yung end stage po, yan po yung kailangan nyo na talaga mag-dialysis. It means hindi na naka-recover yung inyong kidney. Pwede po kayong nasusuka. Pwede po yung kayong nahihilo, nasusuka. Generally, masama ang pakiramdam. Bumabagsak ang pag-ihi, sakit ang likod, yan, marami pong mga senyales yung yan. So, dun po sa mga may chronic kidney disease, yan po, mas iingatan po natin yan. Kasi mas prone po kayo na pwedeng magkaroon ng acute kidney injury. Yan. So, ano pang natin dyan? Sister Rodeline Harang daw, Ayan, si Sir Orlando, salamat po. Ayan, salamat din po, sir. Ayan, salamat po sa pagtambay, Sister Lane Sorson. Yan. Okay. Alin po ang mas mura? Sabi ni Sir Orlando Oliver. Alin po ang mas mura sa Pilipinas? Ang PD o HD? Mahirap pong sagutin yan. Ang alam ko, meron po silang tinatawag na sa Pilipinas, hindi po ako 100% sure, pero meron silang tinatawag na Z package sa mga PD patient. At according po dito sa group, yan din po yung ino-offer nila sa Philippines, yung Z package. Medyo matagal pong i-process, pero yan po yung ginagamit ng peritoneal dialysis na budget. Sa pagkakaalam ko rin po dun sa hemodialysis naman, yung PhilHealth ay nagbibigay ng 90 treatments in a year. Tapos after po nun, kailangan nyo nang mag-cash out. Okay, sa access naman po, yan, kasi sa peritoneal dialysis, bibigyan ka ng isang catheter sa tiyan, and then that's it. Basta ingatan mo lang siya, no? Doon naman po sa hemodialysis, initially, baka pwede kang lagyan ng temporary line dito sa may leeg. Okay? Yan po yung vascular catheter na nilalagay dyan. Temporary lang po yung for 2 weeks. Dialysis kayo. Tapos, pwede rin po kayong lagyan ng either tunneled line, yun pong catheter dito sa may leeg. Naka ano po yan, semi-permanent po yan. Or, lagyan kayo ng fistula. Yung pong fistula na yan, yan po yung pinagkakabit po yung artery at saka yung vein. Para po yung vein lumaki, tapos doon po nilalagyan ng tinutusukan ng 2 needle para po mag-dialysis. Yan po. Yan, salamat po. Kaway, sabi ni Kaway Kuys, salamat po, host. So, you're welcome, Kaway Kuys. Ayan. Yeah, so I'm not really 100% sure kung ano ang mas mura sa Pilipinas, kung PD o HD. Yeah. So I guess it's, it's for us to find out kung ano talagang mas expensive. Consider natin kasi pag nag-hemodialysis tayo, we need to travel 3 times a week. Sa bahay natin, papunta sa dialysis center, tapos pabalik uli. Tapos, mas ano yata, meron din silang, bagay, parehas din naman. Nag-erythropoietin injection din po lahat yung mga yan. Yan. Yan, sabi ni Sir Orlando Oliver, nagpapatanong po kasi kapatid ko na nagdadialysis ngayon at nagpapatanong about PD. Salamat po sa information. You're welcome, sir. Opo. Yun na po narinig ko. Merong tinatawag sila na Z package na dapat mai-apply nyo po kaagad. Kasi medyo matagal po yung processing noon. Tapos mas mainam po na mai-apply nyo na para pag nagsimula na po yung actually sabi nyo nagda-dialysis na ngayon para po maaprubahan na yung kanyang application. Dahil po dito makakuha kayo ng free supply. Yan, may harang naguli si Sister Lynn Sorson. Yan, salamat po. Shout out yan from Annalyn Adnan from Pakistan. Yan po, bago nating kaibigan si Annalyn Adnan. Na-miss niya ang ating shout out kanina. Annalyn Adnan. Yan, sinyout out po kita kanina at the start of my live streaming. Yan, replay mo lang, sister. Yan, okay. Balik po tayo dito sa ating PD natin, yung bagong PD. Ang sabi niya, sabi ko pa sa kanya, Yan ang paglabo ng output niya ay signs po ng infection at kailangan itong mabigyan ng mabilis na lunas. Tapos mag-record din po kayo ng mga bag exchanges nyo. Yan, yung mga peritoneal dialysis. Make sure na nire-record nyo yung anong oras, ilan ang nilagay nyo, at ilan po ang lumabas. Okay, importante po na nakikita nyo kung ilan yung pumasok, kung 2 litro po yan, dapat mas mahigit pa sa 2 litro ang lalabas. Okay, ano pa? Basta tama po ang paglilinis at preparation ng linya, hindi po magkakaroon ng infection sa linya. At pwede po itong tumagal ng maraming taon. Yan. Opo, basta maingat lang po kayo sa linya. Ayan. Yan, si Sister Rodelyn Amistoso. Hello, mega love shout guys. Yan, mega love shout po sa lahat. Yan, marami po tayong group dito sa even here in dialysis and kidney transplant group Yan. We had a question here earlier on. Yeah, she's she's very happy. She had a transplant call. This one of our member in the dialysis and transplant UK. I was just reading her message, and she said she had a call, and then the next day she was very happy. She said she had the transplant and it was working well. So I'm very pleased, that she, that her transplant is working. Yan. Yan, nagpapasalamat po siya doon sa kwan. Nag-donate. Okay, dito po sa UK, automatically naka-register po kami as a organ donor. And it's up to you if you want to opt out, no? Yan po yung yan po ay choice nyo po yan. Nasa sa inyo po yan. Ayan, sabi ni Sister Gilan, yan, nag-mute lang daw siya kasi nagpapatulog ng baby now. Sige lang po, Sister Gilan. Okay lang po. Napakasipag niya si Sister Gilan talaga. Full-time yan. Full-time mom, full-time wife, full-time manager dito sa YouTube. Okay lang po. Okay lang, Sister Gilan. I understand. Yan. Ayan, sabi ni Lynn Sorson, hehehe. Full-time mom, di ba? Maraming diyan eh. Full-time mom, full-time wife. Full-time manager sa YouTube. Kapi-kapi lang po tayo muna. I'm impressed how she managed her time. Do you agree, Sister Lynn Sorson? Oo, sabi niya, all around yan si Guaps Gilan Shin. Full pack. Yes, ma'am. Full pack ka nga. Yan. Salamat sa patambay, Sir Jesse Boy Vlogs. She daw. Huwag daw maingay. Hindi ko nababanggitin pero I don't think I have to mention it. Diba? Kasi everyone knows naman yung mga nandito how hardworking Sister Gilan Shin is. Yan. Agree, sir, sabi ni Sister Lynn Sorson. Totoo, napakasipag niyan. Grabe. Ayan, mega love shout po sa lahat ng nandito. Yan. Tambay-tambay lang po tayo dito. Agree si Sister Lynn. Sister Lynn, baka ikaw din ay full-time, ha? Full pack ka rin ba katulad ni Sister Jilan Shin? I really admire Jilan Shin. How she does it, I don't know how she does it. Uh, Yan, hinahanap ko yung ano dito eh. Ayan, doon po sa mga follower natin dyan sa Facebook. Ayan, unfortunately, hindi po ako makasunod sa inyo dahil meron po akong dito sa may StreamYard. Tapos meron ako ditong YouTube. Tapos merong Facebook. So I hope you understand. I'm not trying to ignore you guys. Hindi ko lang po talaga pwedeng o kayang pagsabay-sabayin. Maski po dito sa kwan. Teka. Maybe I can open it here para masundan ko rin kung anong nangyayari. Nasaan na ba yan? Yan, masundan natin. Pinagkakabit po yung arte. Ayan. Mega love shout po to Jana Aquino. Yan. To Sister Elena Hoson. Yan. Watching from Saragossa, Nueva Ecija, Philippines. Ayan po. Salamat po ng marami. Ayan. Sino pa? Si Sister Grace Bruno Galano. Yan. Thanks po for watching. Ayan. Si Sir Manny Narcisa. Tara na daw, Haji. Laro na tayo. Oo nga, sir. Nakaka-miss. Oo. Hirap din yung lockdown na to. Grabe. Naka-lockdown pa po kami. We're still on national lockdown. So, advised to stay in the house. You're allowed to go out for essential things like buying food, going to work, and you're allowed to go out for exercise. Hindi ko lang alam kung limit lang yon, kung once a day lang. Ayan. Sabi ni Sister Lynn Sorson, yan. Full time in sleeping, sir. Sister Jilan Shin, Sir Hermie, nasa GC Casis. Ayan. Sayang, di ko masyadong marinig. O nga, sayang, di mo narinig. Ayan, si Sir Rodel Mendoza. Ayan, Coach. Kumusta, Sir Rodel? Tumitigas na ang tuhod natin dahil wala na tayong laro. Sabi ni Sister Elena Hoson, very informative. Ayan, si classmate Alfredo Kakam. Hello, classmate. How are you? Ayan, kumusta po? Si Sir, ayan, classmate ko din to, si Lyle Victoria. Ay, syempre, madami ka matutulungan yan. Keep safe. Ayan po. Yan po si classmate nating Lyle Victoria. Ano po yan? Isa po sa mga trusted politicians dyan sa ating lugar sa may Kapas, Tarlac. Sa mga Mekeni, mga Kabalen. Yan. Yan, salamat po. Thank you to Fidel Ancheta. Yan. Yan kay Shirley Reyes Pascual who's watching as well. Fidel Ancheta is in Australia. Yan. He used to work here in UK. I believe, he was already a senior, before he left and now they live in UK. Shout out po Sir Fidel Ancheta. Yan. Yan, shout out po sa ayan sa aking kapitbahay dito po sa likod ko kay Shirley Pascual Reyes. Yan, nanonood po siya. Ah, pwede ko po siyang palipatin dito, Ayan, hello kay Sir Glenn Domingo. Yan, he's also Sir Glenn Domingo also came from UK and now the whole family migrated to America. Hello, shout out to you, Sir Glenn Domingo, and thanks for watching our live streaming. Yan. So, yan, sabi ni Lynn Sorson, Guaps Gilan, wala ako dun. Sorna, busy lang ko tawon sa trabaho. Yan. Busy daw siya sa trabaho, pero sabi niya nakahigalan daw siya kanina. Ayan, shout out din po kay classmate natin, Edison Pineda, watching here in Kuwait. Yan po ang mga frontliners natin from Kuwait. Si Sir Edison Pineda. Yan. Thanks po for tuning in. Sayang, na-miss nyo po yung ating video sa kanina about acute kidney injury. But still, thanks for tuning in. And po, we've got 12 million viewers watching us. Thank you very much. Ayan, si Sterling, ba't tumatawa ka dyan, ha? Totoo ba yung sinabi ko? Work ka mo. Pero kanina, tutulog ka lang ka mo. Full time in sleeping. Saka ba nagwo-work ka, Diretso ka na, Sister Lynn na tawag ko sa'yo. Sister Hermie. Hindi kaya, sir. Ano yan? Nagkandakuba na ako. Hirap talaga breadwinner no? Ay, oo, mahirap talaga. Yan. Mahirap talaga ang breadwinner. Yan. Salamat po sa inyong lahat. Ang dami pa palang nakatambay dito sa atin. Yan. Sabi ni Sister Lynn Sorson, home base ako, sir, sa UK Kunuhay. Ano? Lynn Sorson, ano yan? Panganay? Panganay ako. Okay. So, panganay pala yan si Sis Lynn Sorson. Kaya siya ang breadwinner. Ayan na, si Kaway Kuis. Dito lang host, nakikinig. Yan, si Kaway Kaway. Mag-practice ka na, Kaway Kaway. Malapit na ang ating konsyerto mamaya. Yan, sabi ni Sir Glenn Domingo, thanks idol. Keep it up and regards to Portsmouth friends. Pogi ka pa rin, idol. Mas pogi ka sa akin. Ayan, salamat po kay Sir Glenn Domingo. Yan. And regards po doon sa mga kaibigan natin dyan sa Portsmouth. Yan. From Glenn Domingo from USA. There you go. Shout out also to Cathy Edwards. Cathy Edwards is watching at the moment. You miss the acute kidney injury video, Cathy, but you're able to review this video later on. How are you, Cathy? Hope you're doing okay. I'm on a leave for 2 weeks at the moment, so just relaxing in the house. Yeah, mega shout out to you, Cathy, as she's one of our renal team, part of the renal team, one of our friends in renal family. Yeah, Cathy Edwards. Yan. According to Lane Sorson, hanggang 2 p.m. ako. UK. Yan. Salamat po sa inyong mga patambay dyan at patamsak and like. Ayan. Yan. Sabi niya, seryoso ako sir. Nagwo-work ako home base. Then physical naka-base sa UK. Really? Kaya nakatoka pa ako hanggang 10 p.m. Then 2 p.m. GMT. Tama po ba sir? Oo nga, naka-base. Yes. Okay. So Lynn Sorson, you're working in home base. Okay. Naka-base sa UK. Yes, it is. Kaya nakatoka pa ako hanggang 10 p.m. 2 p.m. Tama, 2 p.m. dito. Oo nga. I love home base. Yan. Lagi ko pong pinupuntahan yan if I want to buy household stuff. Yan. Home base. Tama, 2 p.m. 2 p.m. dito, tama ka. Yan, si Sir Alex Abais. Yan, shout out po. Mega love shout out to Alex Abais. Yan po from ating Team Explorer. Yan. Hello to Eddie. Sir Eddie, hi. Haji, yes, hello, Sir Eddie. How are you? I've missed our badminton days. I wish we could go back soon and get out of this lockdown, because I'm sure everyone is getting fed up on this lockdown. I'm very unfit at the moment, so I need to start running again and do some exercise. Ayan. Salamat po sa pagtambay, Sir Jesse Boy Vlogs and Sister Only Nedge. Yan, sabi ni Sister Lane, yes sir. Kaya tutok lang po sir. Salamat. Okay. Thank you very much po sa iyong pagtutok dyan. Yan, mega love shout out to Johnny Kalumpita, who is tuned in at the moment. Yan po, si Sir Johnny Kalumpita ay isang oncology specialist nurse po yan dito sa UK. Yan, mega love shout out to Johnny Kalumpita. Hello sir, kumusta po? Yan, hindi na tayo nagkikita kasi lockdown tayo eh. Tambay lang po dyan. Yan, Sir Johnny, yan, kumusta pare? Well done. Oo, yan. Salamat po, yan. Mahirap ang lockdown, kaya yan, dito lang tayo sa bahay. So, yan, si classmate Annalisa De La Cruz Pineda is watching as well. Hello, mega love shout out to Annalisa De La Cruz Pineda, my classmate. Yan po. Yan. Thank you. According to Johnny Kalumpita. Thank you pare. Good yan. Pare, collab tayo minsan. Oh, sure, of course. Mag-collab tayo. You know what? Every Friday, nga pala, mamaya pa lang mga 2 p.m. Mag-start kaming every Friday yan, nagkakaraoke kami Friday. Yan, pampa-relax lang ba? Yan. Salamat po sa inyong patamsak. Yan. And nice to see our classmates here, Annalisa De La Cruz Pineda. Yan, si Edison Pineda. Yan po sila ay both nurses from Kuwait. Yan, salamat sa patambay mo diyan na Sir Essing and Jesse channel. I love your cooking channel, cooking videos. So if you're on to quality cooking, yan po, puntahan niyo po si Essing and Jesse channel. Napakaganda po ng mga niluluto nila na kwan dyan, ng mga videos. Yan po, pasyalan niyo po yan. Essing and Jesse channel, yan po. Yan, maraming salamat po. Sir Jesse, salamat po sa iyong pagtambay dyan. Kaway-kaway, kay Kaway Kuis. Mag-practice ka na dyan, Kaway Kuis. Ayan, sabi ni classmate Annalisa. Hi mate, kumusta? Yan. Ang dami na natin, meron tayong, ilan na yan? Meron tayong 17 million dito sa YouTube at 7 million dito sa Facebook. Ayan, Amor Balete Ibarra is, yan, welcome sir to our live stream, yan, welcome po. Si Sir Amor Balete Ibarra po, yan po is classmate po natin yan. Isa po sa mga Bosconyan. Yan. Kabatch ko po yan, si Sir Amor Balete Ibarra III. Yan. Hello, Alfie Domingo. Yan, welcome po sa ating live stream. Tapos, ayan, salamat daw. Thank you, host, sabi ni Essing and Jesse Channel. Yan, you're welcome, sir. Totoo naman yun di ba? Pagka yung mga quality video na ganyan, dapat yan pinopromote. Tsaka lucky ako kasi kasama ko yan sa team. Di ba? Meron tayong mga pinagmamalaki. Hello, Selma Chen. Welcome to our live stream. So we were watching acute kidney injury earlier on. Yan. Yan, napayehe na si Sister Lynn. Ayan, mega love shout to Sheila Tita Ortiz Tabirara. Well, watching from Riyadh. Ayan. All over the place na po tayo. Buong mundo ay nanonood sa atin. Welcome po. Welcome to our live stream. Ayan, ito pa ang ating colleague na si Alex Joanna Lopez. Yay, may YouTube na din, Kuya Johnny Columpita. Yeah. Ayun, pwede nang mag Jonah, pwede nang mag-collab kay Sir Johnny Columpita. Yan, salamat po sa paharang Andrelin Amistoso. Yan. Sige lang po. At ito si Lane Sorson, harang ulit sir, para sulit. Nako, ang daming paharang. Yan, mag-ano lang po kayo dyan. Sino pa bang hindi ko nalagyan ng dyan? Nalagyan ng jacket. Si Sir Jesse Boy ba? May jacket na ba? Ay, di pa pala. I'm sorry, Sir Jesse Boy. Nilamig ka na yata dyan. Hindi kita nalagyan ng jacket. Tsaka ayan, Sir Essing. Yan, Sir Essing and Jesse Channel. Yan, nilagyan na kita ng jacket po. Yan, sino pang walang jacket dito? Yan, si Sister Sheila Tita Ortiz Tabirara. Yan, gawin nating moderator siya. Yan. Sino pang walang jacket dito? Sister Angeline, wala ka pang jacket? Ang tagal mo nang in and out dito sa akin, wala ka pa palang jacket. Yan. Harang ulit. Ayan, sabi ni Sister Angelina Mistoso, mega mega love shout out to everyone. Ayan, nakapasok na po siya after ng napaka taas na harang. Yan. Okay lang yan, host. Sige lang po, baba lang po kayo ng link. Magbaba lang po kayo ng link. O, doon po sa mga hindi nakaabot, ayan si Sir Joward Gayas Jamil. Yan po, sir. Kumusta po? Salamat po sa pagpasok sa ating live stream. At yan, si Sir Joward Gayas used to be my basketball teammate. At siya po ngayon ay nagba-bodybuilding. Hello sir, kumusta? You're doing great. Yeah, I see your post. Kaya lang sayang naka-lockdown tayo no? Naka-lockdown. Nakasarado ang mga gym. Ayan, Sister Eileen Gatchalian. Hello, mega love shout out to you, Sister Eileen Gatchalian. Ayan. Si Sister Eileen Gatchalian po is a specialist renal nurse, and she used to be part of the our family here in Portsmouth. Pero po ngayon ay marami na po siyang nilipatan. Yan, very well experienced renal nurse. Yan si Sister Eileen Gatchalian. Yan. Ang dami pala nating renal nurse dito. Yan, si classmate, ayan. Marby Tayag, hello classmate, kumusta? Kumusta? At saka si Sir Norram SP. Ayan, dati ko rin na mga kasama yan sa basketball. Welcome po sir sa ating live streaming. Kanina po meron tayong video about acute kidney injury. So, yan po, pwede nyo lang pong i-replay ang ating video. Yan, sabi ni okay lang yan, host. Ayan, sabi ni Sir Jesse Boy Vlogs. Jessica Marie Kapulubay. Yan, welcome po sa ating live stream, Sister Jessica Marie. Yan, it's been a while. Ayan, salamat po sa lahat ng inyong mga patambay dyan. Ayan, magbasa pa tayo ng ating mga messages. Lapag-lapag lang po kayo dyan, mga kaibigan, ha. Ayan, salamat po sa patamsak, Sir Mike Cubs vlog. Ayan, si Sir Mike Cubs is one of our frontliner dyan sa Ireland. Ayan, kasama po niya si si Team Doremi. Ayan, Dialysis. Si Sir Mike, anong ka? Anong area ka? Dialysis ka ba? What area are you working? Is it dialysis? Yan po, shout out to Sister Verlin Jugarganir. Yan, kumusta po? Mega love shout out po sa inyo. Yan, na-miss ko na si Sister Verlin. Medyo matagal nang hindi nakikita kasi lockdown. Ayan, sabi ni Sir Mike Cubs vlog, sa nursing home ako host. Okay, sa nursing home. O nga, dami kayong Pilipino doon Nakita ko dong yung last post mo na video. Dami nyo palang Pilipino doon. Yan, doon po sa mga hindi nakahabol kanina, just watch the replay video. Meron po tayong pinost doon about acute kidney injury. Yan. Yan po sa mga hindi nakaabot. Sir Johnny, anong kwan mo? Anong YouTube channel mo? Yan, ibaba mo dito sa ating kwan. Ibaba mo dito sa ating streaming para maibaba natin, para madikitan mo itong mga kaibigan natin dito. Oh. Yan. Dikitan mo yan, mga legit na mga kaibigan natin. Yan, andyan din si Brother Rod Maglinaw at Faye Bugs. Hello po. Yan. Welcome po sa ating live streaming. Ayan po si Sir Rodel po is one of the basketball teammate. Dati, ngayon hindi na kami nakakalaro. Mas sakit na ang aming mga tuhod. Ito siguro si Sir Mike Cubs mukhang basketballista rin ito eh. Yan, ang aking cousin si Rose Ann Pascual Ramos. Yan po, hello. Welcome po sa aming sa aking live streaming. Yan, about well, it was acute kidney injury earlier on. Ngayon, kwento-kwentuhan na lang tayo. Ayan, mega love shout din to Gilbert Tumbaga and Adi Mabini. Yan. Gilbert Tumbaga. Yan. Faye Bugs, well done. Yan po si Faye Bugs. Yan po, ano po siya, online selling ng mga iba't ibang gamit. May mga bags, may mga yan. Mga damit. Yan, nag-online selling po siya sa Facebook. Yan, so pasyalan nyo po yan, si Faye Bugs. Yan, magaganda po yung mga binibenta niyan. Yan, sabi ni Sister Lane, Sir Host, pwede magbaba po ng premiere. Thank you. Oh, of course. Baba lang po ng premiere. Kung meron po kayong premiere o live schedule, just put the link down there and yan, matamsakan po natin yung mga kaibigan po natin dyan. Yan. Ba yan? Baba lang po ng link. Ayan, sabi ni Sir Mike Cubs Vlog. Sabi niya, BG lang ako host. Oh, sige sir, okay lang. Okay. No problem po. Maraming salamat sa pa-background mo dyan. Ayan, salamat sa pag-stay Sir Jesse Boy Vlogs. Yan, pasok na si Sir Angelito Gamit. Arang haba. Tamsakdan na. Yan, salamat Sir Angelito Junior Gamit. Yan po. Isa yan sa mga gwapong-gwapong ka-teammate ko sa Explorer. Yan. Ayan. Ayan, nandiyan po, nagbaba po ng link si Sister Lynn. Ayan, puntahan po natin yan. Pasyalan niya natin yan. Sister Lynn. Puntahan natin. Ayan, tamsakan na natin yan, yung link ni Kwan. Ayan, punta lang po natin yan, Ayan. O, di ba? Sabi ni Sir Angelito Jr., correct. Ayan. Ayan, si Kaway Kuis. Hot, okay na ako para kantahan mamaya. Sige, sir, mag-ready ka na ha. Okay. Sa ilang ano ba tayo? Ayan. Ano na tayo in few minutes. End na rin po tayo ng ating streaming. Maraming salamat po sa lahat ng yan, nakatambay sa atin ngayon. Saan tayo? Yan, mega love shout out po to all our dialysis support group. Maraming salamat po diyan sa ating mga contributions, mga messages, mga support. Yan, nakakatulong po yan sa mga bagong relatives o patient. Lahat po ng ang tawag dito, ng information na binibigay nyo. Napakalaking tulong po niyan. Ayan, tamsak na daw from Arlene Rivera. Ayan, Sister Arlene, salamat po. Hindi nyo inabutan ng ating doon sa pinaka-umpisa. Ayan, nag-shoutout na po ako sa inyo. Ayan, may harang pa daw. Salamat po sa inyong paharang dyan. Ayan, maraming salamat. Baba nyo po yung Baba nyo lang po yung inyong bahay dyan, ha? Ayan, habang may time pa tayo. Ayan, Sister Arlene. Ayan, meron ka ng jacket. Ayan, hindi ko pa pala nalagyan na si Sir Mike. Sir Mike, meron ka na rin jacket ha? Sorry. Ba't ako'y mabagal yata ako ngayon ha? Ayan, kompleto na po. Ayan, may mga jacket na tayo. Baba lang po ng link. Baba ng link. Baba lang po dyan. Excited na si Sister Only Nedge. Akit na yata siya eh. Sister Only Nedge. Akit ka na ba mamaya? Akit ka na mamaya. Ikaw ang hinihintay namin eh. Ang dami kayang alam na kanta niyang si Sister Only Nedge. Siguro naglilista na tong si Sister Only Nedge ng mga kanta niya. Yan. Sabi ni Sir Angelito Jr., Madam Nedge, magpakita ka mamaya, akyat ka. Yan. Bibigyan ko siya ng yung maigsing hagdanan lang Sir Angelito para makaakyat siya kaagad. Yan. Yan, nakapasok na si Sister Arlene Rivera. Yan, meron ka na bang Ayan, tawa na naman si Sister Only Nedge. Bigyan kita hagdanan ha, promise. Ayan, magdikita lang po kayo at magmahalan dyan at malapit na po ang Valentine's. Maglablaban po. Yan, sabi ni Sister Lynn Sorson, hello at Jesse Boy Vlogs. Thank you so much po. Tamsak lang po dyan sa premiere ni Kwan ha. Ni Sister Lynn. Dali lang. Ano lang po natin yung kanyang Kwan. Yung link po ni Sister Lynn sa kanyang premiere. Yan, ano lang po. Tamsakan na lang niyo po yan. Yan. Nandiyan po sa taas. Ayan, thank you. Mega love shout po sa lahat. Yan. Magmahalan. Ayan. Sabi ni Sister Only Nedge. Ayan, Sir Angelito, i-ready mo na daw ang carpet, sabi ni Sister Only Nedge. Sige, i-roll yun na yung carpet at pagandaan ang pag-akyat niya. Gusto mo ba, Sister Only Nedge, yung may ano pa? May flower petals pa? Okay, right. Ayan, basta, sabi ni Sir Angelito, basta magpakita only Nedge. Okay guys, I will tawa si Sister Only Nedge. I will end my streaming in oras na ba? 8 minutes. And then we can restart our session later on. Our Friday karaoke. So whoever is free, you're more than welcome to join. Yan. Natin tong ating Ayan si Sir Rodel at saka Sir Rodel Mendoza and Rod Maglinaw. Yan. Sila po ay yan ang mga ating mga teammate dito sa Portsmouth. Mga old teammates. Kaya pa ba? Baka hindi na makatakbo tong mga to. Wala, kami hindi na kami makatakbo. Wala nang exercise. Oo, yan. Sabi ni Sister Only Nedge, magdi-dinner muna daw sila. Late dinner. Yan. Sige po. At si Sir Angelito, may premiere pala ako ngayon, host. 10 p.m. Pinas time. Ay, ganun ba? O di, puntahan natin yung premiere mo and then we can start our session. Bilis lang naman siguro yon. Oh, no problem, sir. Ilagay mo yung premiere mo dyan pala. Sino bang dito? Bakit tayo lang naman yata dito? I think we had the Team Explorer ba? Ayun, nandiyan pa siguro yung ating yung ibang team naka-background lang. Team 1 goal natin diyan. Ayan. Sir Jesse Boy, talagang naka-stay si Sir Jesse Boy. Salamat po, Sir Jesse. Yan. 10 p.m. Sakto mga rito yun. 2:00. Oo. In half an hour. Yan, si Sir Angelito. Puntahan na lang namin yung iyong channel. Yan. Salamat sa pagtambay, Sir Jesse Boy. Ayan, ang aking classmate. Dumating din si Sister Joy. Sister Joy, kumusta po? How are you? Ayan, salamat sa iyong papuso, Sir Rod Maglinaw. Yan po si Sir Rod Maglinaw is na po yan. Manager na po yan dito sa isa sa mga kilalang grocery shop dito. Ang tawag po dyan is Lidl. Yan. Makikita nyo po yung mga truck na dumadaan, makikita mo yung picture ni Sir Rod Maglinaw. Makikita mo dyan. Siya ang ano ang muka ng Lidl. Diba? Tama, Sir Rod? Ayan. Kumusta sa ano classmate? Yan. My friend Joy Yodge Brown. Yan, meron pa po tayong mga ilang minuto tapos mag-e-end na po tayo. Ayan, salamat po sa lahat na nagpunta at diyan po sa sa mga nakapakinig dun sa ating acute kidney injury video. Yan. Yung mga na-late po na nagpunta dito, pwede nyo na pong i-replay. I played the video on the start of this live streaming. Ayan, mega love shout out to Cherry May Clifford. Ayan, kumusta po? Ayan, isa rin po sa aming family yan sa G9 Renal Department. Ayan. Ayan, sabi ni Sir Rod Maglinaw, di ako manager, model lang. Akala ko, Sir, manager ka. model pala. Bakit base na base? Dapat model nakakuan. Hindi, maganda yun. Pag nakita nyo yung truck ng Lidl dumaan, makikita nyo yung picture ni Sir Rodel Maglinaw. Yan. Siya ang nagre-represent ng ng shop na Lidl. Yan, salamat po sa papuso at iyong pa-thumbs up, classmate George Brown. Yan. Ayan, si Cherry May, when are you coming back to work? Yan. Yan, sabi ni Jesse Boy Vlogs at Adobong Briton, welcome po sir. Nako, maraming salamat po. Yan. Andyan pa si Sister Lynn Sorson, nakatambay. Ano ba yung Sister Lynn? Palabas ka pa lang ng 10, kamo? Palabas ka pa lang? Matatapos ka na ng 10 p.m. Sir Rodel Maglinaw, dapat pala doble ang sa'yo. Doble ang bayad. Kasi manager na, model pa. Ayan. Mega love shout out to kapatid nating Chel I. Ross. Ayan. She's watching from not far from where I am. Because we live in the same place. Ayan, Tita Chel, kumusta? Ayan, tayo mag-e-end na po ng in a couple of minutes. Mag-e-end na po tayo ng ating live stream because ito po dito sa acute kidney injury natin topic. So mamaya po meron tayong another live stream. Yan po yung ating karaoke lang naman Friday. Yan, doon po sa mga free, yan, pasok lang po kayo. Ayan, sabi ni Sister Lynn Sorson, out ako work 10 p.m. sir. Ayan, out na pala siya. Hindi ko alam may home base. Teka muna, saan yung home base naka-base? Sister Lynn. Sa anong lugar? Ayan, si Sister Yodge Brown. Miss you, Adobong Briton. I miss you too, kapatid. Yes, go. Long time. Kailan kaya tayo magkakasabay umuwi? Ayan. Anyway, yan. End na rin po ako ng ating live streaming dito sa sa acute kidney dialysis. And thank you very much for tuning in dun sa lahat po ng ating mga viewers. Hope you learn something from that video. Dun po sa mga na-late, pwede po nyong i-replay ang video. It was played during the start of the live streaming. It's all about acute kidney injury. Yan, dun po sa mga biglang sakit sa bato. Yan. Review lang po. Ayan, si Sister Lynn Sorson. Lancashire ka pala? Oo. Oo nga. Kaya nga, 10 p.m. pa ang ano mo? 10 p.m. O 2 p.m. Sabi mo, out ako work 10 p.m. Okay. Nako. 2 to 10 ang ano mo, ang pasok, Sister Lynn. Ayan, salamat din po Sir Angelito Jr. Gamit. I will make sure na pasyal ako dyan sa iyong premiere at 2 p.m. UK. Oo, tapos mamaya magkaraoke. Yan. Welcome Sir Tim Doremi. May shout out ka kanina during the start of the video. Just replay the acute kidney injury video. Nandun po yung ating mga new channel members. Yan. Maraming salamat po. Yan si Sir Essing and Jesse channel. Maraming salamat po. Yan, papasok na rin si Sister Lynn. Yan, na siya. Nagka-cup of tea. Cup of tea na si Sister Lynn. Yan, thank you. Ayan, salamat po Team Doremi. Lunch muna daw tayo. Bale, medyo na. Saka ba sir, nasa dialysis ka ba ngayon? Nagda-dialysis ka, may pasok ba? Ayan. Sir Essing and Jesse, I appreciate it. Thank you for staying. Ayan, marami pong salamat. Ayan, natawa na si Sister Lynn Sorson sa ating kwan. Totoo yan, mga cup of tea. Sir naman. Ayan. Doon po sa kwan yung mga bago dito, ayan, pasyalan nyo po yung mga channel na yan, at yung mga ka-team natin dyan, si Sir Essing and Jesse channel, si Jesse Boy Vlogs, yan, si Sister Jilan Shin na medyo busy pa, nagpapatulog, yan. Sige po, doon po sa mga hindi nakaabot, just review the video for acute kidney injury doon sa start ng ating live streaming. Ayan, so kaway. Ayan, sabi ni Team Doremi, katatapos lang, on call tayo sa ICU today. I see. Okay. Ano ba yan, Sir Team Doremi, ICU full of siguro yan, COVID cases. Ano ginawa mo dyan, sir? Nag-dialysis ka ba? Yan, minsan po kasi tumatawag sila ng tulong sa ICU kasi napakabigat na po ng ICU ngayon dahil napakaraming cases nga ng COVID. So, yung mga staff sa theater, yan, tinatawag po nila kasi most of the elective cases, kinancel po nila yan. So, yun po mga staff ng theater, tumutulong na rin po sa ITU. Ayan, kumakain pa lang si Sir Tim Doremi. Yeah, mega love shout out to Sir Eugene Evelyn Kinain. Ayan, welcome po sa ating live streaming. But ako'y pa-end na po, kaya po kayo nagpapaalam na. Okay, so dyan po sa ating 11 million viewers, kailangan ko nun po magpaalam sa inyo. At saka dito po sa Facebook Live. Yan pong mga naka-tune in ngayon. Yeah, so until next Friday po uli. Ayan, sabi ni Team Doremi, acute HD lang to kayo. Oo nga. Minsan ganyan kailangan ng specialty. Yan po si Team Doremi, dialysis specialist nurse po yan sa Ireland. Ayan, well done, Team Doremi. Yan, for providing your specialist skills. Yan, thank you po. Thank you po sa lahat at mag-iingat po tayong lahat. Yan, importante po yung mga napag-aralan natin ngayon sa acute kidney injury. Sige po, maraming salamat at ako po'y mag-i-end na. Thank you po. Keep safe. God bless you all.